allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, so I changed up the order of things ever so slightly, only because one of our board business, one of our organizational issues is that we are anticipating having an election for new officers tonight, and I thought we could open that up, have that after public comment, so that if the public wanted to comment on that election, they would have the ability to do so. With that, we'll move right on into the approval of the minutes. I have one correction note, which is that Karen Foundation in the minutes is spelled like the name Karen is K-R-E-N, but the foundation is spelled C-A-R-O-N. That is the only correction I wanted to note. Does anybody have anything else in regards to the minutes? All right, so with that, Maggie, that's such a minor change. Can we just have a motion to approve as amended? All right, would anybody like to make a motion to approve the minutes as amended?
Move to approve.
Second.
All right, all in favor? Aye. All right, motion passes unanimously. With that, we will move on to our reports, and we will start with our report from our school board liaison, Panayotta.
Good evening, everybody. Just a short report today. We do want to, just remind everybody it's the end of the school year, and we look forward to our students enjoying their summer vacation. In terms of, what we're seeing in the nurses' offices, same, pretty much the same thing as last month. Lots of allergies and all the fun stuff that goes along with that, headaches and some pink eye, a few cases of strep throat, sore throats, and that's pretty much it. I did want to bring to the attention of the board that the pay survey did come out, and we presented on that at the May Board Curriculum Committee meeting. That is, on video if you would like to watch that, but the results were, very positive. The survey showed a decline in nearly all substance use categories for all grade levels compared to our 2021 survey. 10th and 12th grade students reported a decrease in the use of the three most prevalent substances, alcohol, marijuana, and the use of vaping devices. Marijuana and vaping rates amongst 10th and 12th grade students are lower than our state averages, and 10th grade students reported significant decreases in the past 30-day alcohol use and binge drinking rates. A larger percentage of students perceive substance use as a moderate high-risk activity compared to what was reported in 2021, which speaks to the prevention and intervention that we are doing, across the schools, especially the middle school and the high school. When if you look on the board meeting minutes, there was a document that was put together by Student Services and Teaching and Learning that explains the different pieces that we have in place both at the middle school and the high school, and also some items that we'll be putting in place in addition to what we already have for next year. Thank you.
And just to clarify, when you say it's on video, the PACE survey presentation, that's the school district YouTube page?
That is
for
correct.
anyone who wants to find it?
Yes,
All
thank you.
Does anybody have any questions for our school board liaison or any comments related to the schools? All right, well, I'll just wish all the seniors a happy graduation, in particular our 3 outstanding student interns from this year. I got to see them all at the graduation rehearsal today. I was there to help the League of Women Voters do some voter registration. So once again, congratulations to them. With that, we'll go to our Board of Commissioners liaison, Maggie.
Thanks, Alex. I have not much to report as far as Board of Health issues, but a couple of little things to highlight. First, our next Board of Commissioners meeting is on Monday evening, and we've gone to the summer monthly Board of Commissioners meeting. So instead of twice a month, we're only meeting once a month for the summer. One thing of note, and I'm sure you will all notice it, is that the Public Works and tree companies are doing a large hazardous tree removal within the township. So you'll see color-coded systems in the parks. It's mostly in our parks or along the trail, that trees that need to be pruned, trees that are either dead or in peril, or are dangerous, will be coming out. And that'll be happening over the next couple of months. The other thing that everybody notices, and David and I were just talking about, is it's summer, so it's road work time. PennDOT has huge fleets of trimmers out, so be careful when you're driving. There will be some township road work. But the good news is Conestoga is almost done, if not completely done. So. The only other thing that's sort of fun to note is that our Environmental Advisory Council has been hard at work starting some new projects. One of them was presented at the last Board of Commissioners meeting, which would be the possibility of replacing all of the or much of the just mulched areas with some perennials, low growth, low maintenance perennials in hopes, one, they're green, and isn't that lovely? But also to keep the mulch from clogging everything up and causing more stormwater issues. So they're also starting to look into my pet peeve, which is gasoline-powered leaf blowers and weed whackers. So there'll be more on that in the future. Happy to take any questions if anybody has
Yeah,
them.
I have two questions. One of the first things I did when I joined the Board of Health was bring to the Board of Commissioners a request for issues related to the noise of gas leaf blowers, and I was summarily dismissed at the time. But I think that is something that the EAC ought to join hands with the Board of Health, because the issues are beyond just.
And they're beyond just noise. The pollution they make, the two-stroke engines that, where you mix the oil and gas are incredibly polluting.
They are.
I just saw a whole webinar about it, and it's something we need to address. And of course, Public Works will need to lead by example. It'll have to be a phased-in thing. We're just starting to nibble around the edges, so it'll be expensive. Now, know that the electric leaf blowers, battery-powered leaf blowers, are not that much quieter than the gasoline. I mean, they are quieter, no question. The data's good on that, but they still make a lot of noise. Rakes would be ideal, but good luck with that. So they're starting to collect data on it, because there is a lot of data on the amount of pollution, and you see these landscaping teams out there, they're breathing it every day, much of the day. I mean, my neighbors have their landscapers out, and I can smell it in my house.
On the noise, the comparisons are unfair, because the gas blowers run at many higher horsepower per RPM, so that for an equivalent amount of per minute volume of air moved, the electric blowers actually are quieter. But
they are quieter, no, and there's decibel data on that. They are. It's just they're still pretty loud.
they are. They're still going to be loud. The other question I have for you is, can you give us an update on the Kratom lawsuit?
The Kratom place, as you know, I don't know if you know, is no longer there. We have been, I can't speak too much about it because not much is happening. We've been trying to contact their lawyers. There's nothing coming to us.
Good.
So,
thank you.
yeah, so I think that's good,
Yeah.
but I can't say it's over.
Does anybody else have anything for Maggie or relating to the Board of Commissioners? All right, so with that, we will move on to Delaware County. The Jefferson Health Mammogram Screening Event is occurring at the Chester office tomorrow, June 11th, from 9 a.m. to 3 p.m. Please visit the county website for registration information, but it is a free mammogram. Also, the county has launched the Delco Revive campaign. This campaign encourages people to carry the tools of life with them, including Narcan, and also offers some training sessions for schools and businesses that are interested. Department Director Melissa Lyons stated, "We may never know if and when that day will come that someone struggling decides to seek recovery. I urge everyone to carry the tools to gift one more day of life. So found that quote pretty compelling. For more information, anybody can visit delcorevive.com. Does anybody else have anything related to anything going on at the county?
No, Alex, can I add one comment, though? It's not really a county issue, but it's your mammogram screening. I know Penn Medicine is also doing free mammogram screening this month, so.
Excellent. I don't have anything relating to Radnor Fire Company this month. Does anybody? Okay. So moving on to presentations and programs. Student presentations, once again, I'd like to congratulate the students we had this year on the excellent presentations that they did. With relation to Finn and the bike program, I did want to note that 2 days after our last meeting, we entered into a 4-day span where air quality was ranked as poor, which is only one level below unhealthy, and that's the level where they basically start telling even healthy people to start spending less time outdoors. So the primary pollutant was ground level ozone, which is primarily caused by car emissions. So one more reason to consider biking where possible. And then the other thing we have going on with student presentations is, Lisa, you emailed the today. Go ahead.
So I just reached out today to the guy, I guess it was the head of guidance, JJ Lemon at Radnor High School, and I just sent him the solicitation letter so that he could pass that along in case the prospective interns wanted to do that over the summer, because we do ask a lot of them, and if we want to have a September, late September turnaround, I thought it would be nice for them to at least know what was going to be expected, and if they wanted to gather some things over the summer, they could do that. So he already did send it out. He sent me an email today to say that he passed that. I don't know if it goes through Schoology or what, yeah. And then just for a reminder, email from me to him when school starts again. I did actually have Amy West, who is one of the guidance counselors, reach out to me because an intern, a potential intern, was already asking about the position. So hopefully we have a lot of interest. We'll see.
And then I'll also just, since I won't be here, but I'll remind you that in past years, one of the things we've also done is reached out to students who applied in the past who weren't selected to see if they want to apply again this year, in particular if they took advantage of the opportunity to get feedback on the prior year's application. And I think you have their emails already, but I'm also happy to send them to you just if you need them. Yeah. And then Ian, do we have Kiki on Zoom? Because I think she wanted to make a comment in relation to the student intern project. Oh, okay.
And can I just ask, is this Radnor Township High School, Carroll's not part of this, or should they be part of it? Or?
So our practice in the past has been to advertise only at Radnor High School, and the reason for that just has to do with the practical implications of going outside of the high school, because they have to be a Radnor resident. So some of the students at the private schools that are in Radnor aren't Radnor residents, and then there are Radnor residents who go to schools that are outside of Radnor, and it's just a little too complicated to figure out all of that advertising. That said, if there are students who are not Radnor Public High School students who apply, as long as they are in high school and they're a Radnor Township resident, they are eligible to apply. We just don't really have the resources to capture all of that advertising.
Got it, thank you.
She doesn't seem to have joined yet, but I'll
Okay.
keep an eye on if she's.
Okay. I think I can summarize it. Basically, she is sort of semi-belatedly offering herself up as a potential additional student intern supervisor with an idea for a project. So maybe, we can send an update if needed via Schoology. The project centers on addiction and recovery. So I don't know that I can go into too much more detail than that, but, and that's something that I think we can connect offline about as needed, but so you might have one additional helper on the student intern projects for next year. Does anybody have anything else related to the student presentations, either this year's or next year's?
I'd just like to thank our Board of Health members who ran the program this year. It was very nicely done, and the presentations were very, very spiffy for high school kids. Those were very spiffy presentations.
Oh, and actually, I also have one additional thing to share, which is Chloe, who announced at the last meeting that she was going to be attending college in Radnor Township at Villanova, has expressed some interest in staying on and filling the social media intern position for the time being, and then potentially also applying for, in addition to my seat when I step down, there are 2 other seats that are scheduled to open up while she's in college, and she's expressed some interest in staying active, so I think that's a great thing. She did an excellent job on her presentation this year, and although, of course, I don't know who else may apply, I certainly think she would be well qualified for the position, and so she has my endorsement as being qualified. I don't have anything in relation to the oral health program. The SNAP presentation is tonight's presentation. I don't think we really need to talk more about that. That presentation will happen later for those who are able to stay for that. The summer field day for recovery houses, unfortunately, we haven't been able to get a date nailed down. The person I've been working on with that just stated that there were some things going on in the family, and I just stated, whenever you're ready to reach back out. We got the approval from the township to sort of do the event in theory, but we don't have a date nailed down. Maggie, any?
Just turning to.
Oh, I was wondering. So that is tentatively going to happen sometime this summer, but we don't have any kind of a date nailed down for that yet. We did get a date nailed down of September 16th at 6:30 p.m. for Louis DeSanto and his presentation on addiction and recovery. That is almost certainly going to be rescheduled because without realizing it, we picked the Eagles home opener for that presentation. So counter-programming the Eagles is, not really going to work. So although the regular board business meeting is still going to be that day, we will, in 99% likelihood be rescheduling that particular date. And then right up until the last minute, I've been getting these presentations scheduled, but we do have one more, which is October, after the board business meeting in October. That is 10/21, and it's at 6:30 p.m. Again, the way we've scheduled all the rest of these after the regular board business meeting. That is the Glide Fund. They're an organization that deals with accessibility and inclusion for people with physical handicaps. It's a relatively new foundation. It's a family that has a dental practice in Bryn Mawr that unfortunately they lost a son earlier this year. He had been an advocate for disability rights and people with disabilities, and he himself was in a wheelchair from, I believe, a very early age. They are going to be premiering a documentary called Mark, A Call to Action that's going to be at the Bryn Mawr Film Institute Wednesday, June 19th. In terms of the date for them presenting to us, that has been confirmed with Peggy. I just didn't have time to get it on the agenda before we sent that out. In terms of what they're going to talk to us about, they have some things that they talk about in terms of not only the benefits to towns of being more accessible, but also to individual businesses, like the fact that many people who have different kinds of physical handicaps very often will have an aid with them. So if you provide accessibility for them, you're also providing accessibility for their aid. So if you're a restaurant, for example, you might be doubling your revenue by providing that accessibility rather than just increasing accessibility for one person. Additionally, something I'm very excited to hear them talk about is they talk to gym teachers about ways to include children who have physical disabilities. In many, many places, children who have physical handicaps are simply given a study hall when it's time for gym. I don't know what the current policy is at Radnor, if you're able to speak to that or not, or if that's something you can address at a future. Do you already know?
I'm happy to.
Of course. Go
Our
ahead.
students are fully included in our programs, so that's already,
Excellent.
that's been taking place for many years.
Okay. Well, they'll still present on that topic anyway, but I'm glad to hear we're already doing things about that in Radnor. But the basic idea is, of course, just because a child is in a wheelchair from the legs up, they still have a body that is fully functional, that needs to be taken care of and exercised and kept healthy. So, so that's one of the other topics that they are going to talk about. And just, I think that it's a very important topic. One of the things they said, and I've heard this before and I'll repeat it, is it's the one minority category that anybody who lives long enough is guaranteed to join. At some point, everybody's bodies, don't work the way they used to. So that is all about the existing presentations. Does anybody have anything as far as new proposals or anything that they wanted to kind of get out into the ether? All right. So with that, under old business, I have a rather lengthy comment that I would like to make regarding the public comment that occurred at the last meeting. Oh, I'm sorry, did I skip something? Oh.
I'd rather push that to behind you.
I'm sorry, no, I did skip over the discussion of community infectious diseases. David, go ahead.
We could defer that if you
No,
want.
no, 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 go ahead, David.
So just a couple brief comments. The avian flu is a status quo. There was a report of a severe flu case with bird flu in a single individual, which was actually H5N2, not H5N1. I really don't want to spend a lot of time on the hemagglutinin and neuraminidase receptors and all of that, except to say that if you drink pasteurized milk, the milk supply is safe. Raw milk was never safe. There is a lot of surveillance, and the issue that people are looking for is, will a mutation occur that will allow these flus to be transmissible from human to human? That would be the epidemic/pandemic event that people are looking for. Has not occurred yet. This has been under surveillance and going on for over 30 years now, and the good thing is that there is a lot of surveillance. The bad thing is that anytime anything happens, it gets nightly news coverage, which it's not terribly helpful, because science really doesn't happen on the nightly news. Science happens with scientists paying attention to data, which I think is a relevant comment to what you're going to go to, Alex, when I'm done here. So that's flu. There is no evidence yet of a summer bump in COVID or of a new variant that is anything other than marginally more infectious, but the clinical syndromes seem to have abated, with the exception of the particularly vulnerable and at either end of the age spectrum, and long COVID syndromes, which can continue to accumulate. On the measles front, we've been concerned with a doubling in the measles cases in this country, which is in the hundreds, with a decrease from a 95% penetration of measles vaccination to 92.5%. We have a pretty good idea in this country, and that's a doubling. Europe has seen a 60-fold increase year on year to 62,000 cases this year. And again, there's a lot of people out there who were not alive to see epidemic measles, to see measles encephalitis, to see death from measles. or many of the other things for whom they have issues with the vaccination program. A measles outbreak like that is going to send children to the hospital. It's going to have children with lifelong disabilities and babies in graves. And we don't have a great estimate, but the approximate penetration of vaccination in the European countries as a whole is about 85%. So just a 10% drop from the herd immunity level of 95% has led to a 60-fold increase in 1 year. It is, this isn't a maybe, it's not a speculation, it's a real thing. That's it for we don't have it going on in this community yet, but with travel and the summer travel season and Europe being a high-level target destination for travel, although much of the activity is in Eastern Europe, which is less of a travel destination, I think that we need to keep a very careful eye out.
Before we move on to the reaction to last week's comment, I did, when David talked about the doubling, I just want to make sure people understand that's this year we're already at more than double all of last year. And then in terms of it not being in the community, maybe I'm misremembering this, but I thought I had seen that there was a case in Montgomery County, which is...
There was.
Right, which obviously we're not in Montgomery County, but the virus doesn't know where County Line Road is, so...
It did not turn into... So when cases appear, we're off of the vaccine discussion and we're into the quarantine discussion, another politically sensitive discussion for which it's completely obvious. If you lock yourself in a closet, you're not going to get measles from your next door neighbor. But right now there's not new or current activity that I'm aware of, and I keep an eye on it.
Does anybody have anything else related to community infectious disease? So under old business, I put some time for board response to the public comment at the previous meeting. As I was starting to say, I have a rather lengthy response that I've prepared because I think it's warranted, but I did put that on the agenda, and I didn't know if anybody else had anything that they had wanted to say on that topic.
I always have comments. If you'd like my comments,
I'm happy to go last because my comments, like I said, are quite long.
What was the comment?
At our last board meeting, we had some public comment that I feel contained some very serious medical misinformation on the topic of vaccines that I feel warrants some correction.
Yeah, so if you would like to go last at the purview of the chairman, I do have a couple of comments. One was if people were fortunate enough to be able to see what I thought was some very moving coverage of the 80th anniversary of the D-Day invasion of Normandy. We're down to less than 120,000 remaining veterans out of between 11 million and 12 million Americans who served abroad during that conflagration. One of the observations that has been current since I started medical school is that there has never been a reported case of tetanus in a U.S. Armed Services veteran. So I don't know if that made Robert F. Kennedy's books, but it's evidence that vaccinations certainly have a role. In addition, every one of those gentlemen that you saw gathered, if they were 20 in 1944, they're 100 now. They all had vaccinations for yellow fever, typhoid, cholera, hepatitis B, meningitis, whooping cough, polio, and tetanus. And they didn't complain about it because they knew that the reason they were getting those vaccinations was to protect the guys next to them and to protect themselves. The third thing I would like to do is point out, once again, the Board of Health of Radnor Township is a volunteer board without a budget that serves in an advisory capacity for the Board of Commissioners of the township. So public comment at the Board of Health should not be taken as an opportunity for political scree or for political agendas or for disinformation of any kind. And I think it would be kind of the public of the Township of Radnor to utilize the resource of the Board of Health and the public comment for issues to put before the board that have to do with health in the Township of Radnor, where the Board of Health can have a direct impact on assisting the township in such means. And that would just be the neighborly thing to do. That's a personal opinion, and I think relevant to the comments. Opinions are a little bit like armpits. Most people have some, and a lot of them are stinky. So with that, I'll close off.
Does anybody else want to speak about this topic before I go into my, as I said, rather lengthy response? All right. So first I want to say that I respect free speech, and any Radnor resident should know that they can speak freely during public comment, including the right to make comments that I disagree with. No one stopped the commenters at our last meeting. The police didn't visit their house. They didn't go to jail. They aren't facing fines. In a free society, the appropriate response to speech we don't like is more speech. When public commenters use their time to publicize dangerous medical misinformation, it is not only my right to respond to them, but as chairman of Radnor's Board of Health, I consider it my duty to respond to them. A couple of points to clarify regarding public comment policy. Our board's public comment policy is modeled on the Radnor Board of Commissioners' public comment policy. It is and remains board policy that public commenters must begin their public comment by stating their name and address. Although the rules ask for an address, it has been standard practice in recent years to allow people to refrain from stating their exact house or unit number because of doxing and things like that, but they still need to state the street and town name. For most of my time on this board and all of my time as chair, our only regular public comment has come from Sarah Pilling, who we're very happy to have in our audience with us again tonight. I've known Ms. Pilling for well over a decade. I used to live near her, and walked by her house all the time. And additionally, Ms. Pilling has made public comment at literally hundreds of Radnor board meetings over the years. I don't know, Sarah, do you think it's in the thousands, or hundreds is a good number? Anyway, so her address is well known to myself, as well as effectively being a matter of public record in many other board minutes over the years. So frankly, it didn't occur to me to ask her to state her address, but it is part of the rules of public comment. So if it was jarring to our public commenters at the last meeting to have that rule enforced, just know that that is part of the rules. Additionally, our board's rules for public comment give commenters pretty wide latitude. Because we're being simulcast on YouTube and mainline TV, we have to adhere to both outlets' decency standards. This means that public commenters may not use profane or lewd language or gestures. Public comments are limited to 5 minutes to ensure that everyone has a chance to speak. And really, the only other rule we have is that comments have to be addressed to the board chair. So they're not supposed to go one by one down the line and ask individual people questions. Public comment is public comment, and it's supposed to be addressed to the board chair. So when the commenter at the last meeting challenged Dr. Simmons to take a particular action, I felt that this was a violation of that rule. This rule is true at all township meetings, and although they are a separate government entity, the school board has the same policy. I don't relish or enjoy interrupting a public commenter, but when someone comes to our meeting to make public comment, it is their responsibility to know the rules for making public comment. Regarding the substance of the comments were made, and I'm going to be a little bit snarky here and say that I think I'm being generous by ascribing the word substance to the comments. The first commenter began by stating that they were expressing a different view. To be clear, the efficacy of vaccines is long-established science, and it is not a matter of opinion or point of view. Since the introduction of vaccines, deadly diseases including polio, whooping cough, and measles have stopped causing thousands of deaths per year in countries with strong vaccination programs, and in the case of smallpox, we even eliminated the disease. These are facts, not opinions. The commenter next stated that even the best vaccines are only slightly effective. This is an outright lie. Many vaccines have effectiveness rates of over 80%. Many have effective rates of over 90% in terms of preventing disease. A medical intervention that prevents over 90% of cases of a deadly disease cannot be termed as only slightly effective by any reasonable person. The HPV vaccine has an effectiveness rate of over 97%, and again, I would question how anyone could consider a medical intervention that prevents 97% of cases of a cancer-causing virus as only being slightly effective. Even the seasonal flu vaccine, which is one of the least effective vaccines, typically has an efficacy rate between 40 to 60%. Between 2010 and 2023, the lowest number of annual deaths attributed to the flu was 4,900. If it had been just 40% higher at the lower end of the vaccine efficacy rate, that would have meant an additional 2,000 deaths that year. When even the least effective vaccine saves thousands of lives per year, I fail to see how any reasonable person can call vaccines only slightly effective. The commenter then asked Dr. Simmons to produce studies showing the efficacy and safety of childhood vaccines. While I'm sure that David is capable of compiling a compendium of the numerous studies that have been done over the years, these studies are numerous and widely available, and it is not David's job to help people who don't care to do their own homework. In terms of efficacy, I am again going to point to the fact that measles, polio, and many other diseases that used to kill thousands of children every year in the United States no longer do so, and are now only considered deadly in countries that lack universal childhood vaccination programs. And I'll again point out that after a successful vaccination program, smallpox was eliminated from planet Earth and now only exists in laboratories in Russia and the United States. In terms of safety, it is well documented that the number of people who experience severe reactions to long-established vaccines is well below the number of people who die from the associated diseases and far lower than the numbers that used to die before the vaccines were introduced. No medical intervention is ever 100% safe. We can only weigh the risks of the vaccine against the risk of the disease. In the case of long-established vaccines, the evidence is clear. The risks of the disease are much higher than the risks of the vaccines. The commenter also stated that vaccines do not undergo placebo trials. This is a lie, and one that has been repeated and debunked many times. Placebo trials are a standard feature of third-phase clinical trials for new vaccines. Commenter made many comments conflating correlation with causation by alleging without evidence a connection between the number of vaccines given and the rise in autism diagnoses. They also stated that some vaccines do not provide the same level of protection as the disease. This is true in some cases, but it leaves out important context, specifically that the disease may very well kill you rather than provide you with lifelong immunity, whereas the risks of vaccination are comparatively very, very low. Commenter also mentioned the payouts of vaccine courts without acknowledging that vaccine courts can and often do issue payouts without proof of causation. In other words, you don't have to prove your claim, but we're paying you anyway. Commenter remarked about the declining efficacy of the MMR vaccine without mentioning that much of the decline in the efficacy of that vaccine has been attributed to decreases in herd immunity from people who don't vaccinate. Commenter also stated that measles occurs in both vaccinated and unvaccinated populations, and while this is technically true, it is monstrously misleading. 68% of this year's measles cases in the US have been attributed to unvaccinated people. Commenter also mentioned the effects listed in vaccine product inserts. By law, these inserts must list all reactions that have been reported following vaccination during a pre-licensure clinical trial, even if there is no evidence that the vaccine caused the reaction. Commenter also stated that there are safe and effective treatments for measles and suggested that these treatments ought to be an alternative to vaccination. Now, one of the doctors on the board can correct me about this if I'm wrong. There are treatments for symptoms of measles. There is not treatment for the measles disease itself. There is, however, a vaccination that will prevent you from getting the measles.
68% were unvaccinated. Of the remaining 32%, the greatest majority only had one of the two shots. And virtually every case in the United States reported the acquisition was from somebody who was not vaccinated or had traveled to a zone where there was significant measles activity.
Correct. Even most of the cases among the vaccinated were, can be traced back to travel and contact with people who were not vaccinated. Ian, I don't know if, I sent it very last minute, but a slide that I wanted to bring up. Yes. Okay. So then this commenter went into all of the financials about vaccines. So this is something that I want to set the record straight on because it bothers me whenever it's brought up that there's this implication that myself, the rest of this board, whatever doctors and public officials are engaged in this huge conspiracy because of all this money that they're supposedly making on vaccines. So if you look at this chart, what it shows is the bottom bar, that little tiny blue rectangle, is the global revenue from vaccines, and that big orange bar is all pharmaceutical revenues worldwide. Vaccines account for about less than 5% of the global pharmaceutical market. In 2023, this is from 2019 because it's the year that I was able to find data for all of the categories that are listed here. It was a little over 32 billion was the global revenue for vaccines. Now, that sounds like a big, scary number, except again, if you look at the total revenue for pharmaceuticals in that same year, it was over 900 billion. So again, less than 5%. Then, if you look at the next bar up, you will see that all vaccines worldwide were outsold by just the top 3 medications only in the United States: Humira, Eliquis, and Enbrel. And if you notice, what those 3 medications all have in common is that they treat chronic conditions where people basically need to kind of take the medication all the time. Most vaccines are given, once in a lifetime, 2 or 3 boosters for some of them. Flu vaccine is the most frequent one. You get it once a year if you get it. Compare that to mental health drugs, drugs for people with arthritis or chronic conditions that people basically need to take medication for every day, and it's not that hard to figure out. So as you can see, again, there are 3 medications just in the United States that produce more revenue just in the United States than all vaccines worldwide. And then finally, if you look at the graph on the top, you'll see that there is about 135 billion global supplement market, dietary supplement market. That is way more than the global vaccine market, and perhaps that's why these anti-vaccine websites are always hawking different essential oils and dietary supplements that they claim will cure diseases that don't have any real medical evidence for those cures. So if you want to look at where the real money is going, it is not in vaccines. Thank you, Ian, for putting that up. The next commenter asked who's healthier, the vaccinated or the unvaccinated, and then proceeded to state that we don't know the answer to that question. Health encompasses many, many, many different things. There are all sorts of things you need to do to be healthy that do not relate to vaccines. Obesity is a leading contributor to almost any condition that you can think of, and no, there is no vaccine for obesity. Nobody's ever claimed that there was. What we do know is that people who are vaccinated are significantly less likely to contract, be hospitalized for, and die of vaccine-preventable diseases. They repeated this idea that, nobody's ever done these they have these studies that, they want everybody to do that they claim have never been done. And the reality is the studies on the link between vaccines and autism or vaccines and whatever other condition they, want to blame vaccines for, those studies have been done. They are numerous, they are well documented, they have been well publicized. They are out there for anybody to look up. They then promoted a book by Brian Hooker and RFK Jr., referring to them as these, well-respected researchers without mentioning that both Brian Hooker and RFK Jr. have had articles retracted for fraudulent research practices, or in RFK Jr.'s case, just outright stating things that were not true. And by the way, in RFK Jr.'s case, it was not some, weighty medical journal with all of these, super strict standards. It was salon.com that he couldn't meet the standards for. Just to be clear, I realize that Mr. Kennedy is a candidate for public office at the moment. I am not using my position to comment on his fitness or lack thereof for that office. I am only commenting on his fitness, or in this case, lack thereof, to comment on the efficacy of vaccines. They also then said that they were going to give us a copy of the book. They did not actually give us a copy of the book. So again, if anybody's looking for sources of information to trust, you can go watch the video. There was not a pile of books on the chair next to them. They did not have a bag of books with them. You can see in the meeting that they left without giving us any books, even though they said that that's what they were there to do. And then finally, she then made a comment about, shouldn't we really be more concerned about the, all of the people with autism versus 58 cases for measles? Again, if you watch the video, you can see that the laptop that is right there was still lit up and still had the graph that she was referring to on it, and 58 was the number from last year. The whole point of what we were talking about is that that number has grown exponentially larger. So I don't know if people want to take medical information from somebody who wasn't able to properly read a line graph that was literally sitting right in front of their face while they were reading it, but that is the fact of what happened. And then the final comment I want to make is that so much of this discussion around vaccines and autism often turns around the medical accuracy of what the people in the anti-vaccine community are saying about vaccines. And so often left out of the discussion is what happens to the autism community. And I want to take a second to talk about that, because although they didn't say these words in this order, the natural implication of what they were saying is that myself, medical officials up and down the country, and doctors all up and down this country are hurting children on purpose and doing it in a conspiracy with money, and also that they are drawing a comparison between a living child with, a neurodiversity issue and dead children who, die from vaccine-preventable diseases. Kiki's not here tonight. She's one of two people I know who lost a child who was younger than I was, and I take great offense to the idea that there is any comparison between a living child who has a neurodiversity issue and a dead child. That is really, really offensive to me. It's offensive to a lot of people in the autism community, which is why if you look at these anti-vaccine groups, very often people with autism are not actually in any kind of leadership position in these organizations, and instead it's parents who claim that their children have autism a lot of times. And in fact, autism rights activists are very often highly critical of these groups because of the fact that they're excluded. There's a saying in not only the neurodiversity community, but the disability and community in general, which is nothing about us without us. And the idea that these people, claim to speak for people who, for the most part, want nothing to do with them, and then go around accusing other people of trying to hurt this group of people is really offensive to me. It's also personally offensive to me because I worked at the Eagles Stadium for 2 seasons, and during those 2 seasons, I raised over $1,500 for autism research, real autism research, and the idea that, I or any doctor in this country is intentionally trying to hurt children, because of some monetary thing is so offensive. And the idea, the comments again about, comparing, I really want to drive this point home, that comparing of course, there's no evidence about the link between autism and vaccines. That has been very widely debunked. But the idea that there is any kind of comparison between a living, breathing child and a child who's died, I have I actually met a mother at a vaccine conference once whose child died of the flu, complications from the flu. The idea that there would be any comparison between her loss and people who have a living, breathing child that they can, go hug is deeply offensive to me. The sort of the originator of a lot of this stuff in the celebrity world, Jenny McCarthy, once said that when her child's autism symptoms started showing, it was like the soul was gone from him. People with autism still have souls. And the idea that anybody would say that they don't in order to try to make some political point about vaccines is deeply offensive to me. It's deeply offensive to many people who have neurodiversity issues. And that is the end of my comments about the comments that were made at the last meeting. Does anybody else have anything they'd like to say?
I'd just like to add as well that although I'm not taking away from anybody's challenges of having a neurodiverse child or being somebody with autism, neurodiverse people have a lot to teach us as a society and as a community. So to take something like autism and say that's not why we should, that if indeed it's causing it, it's not, that's why we should not be vaccinating our children is ridiculous. The autism community has a lot to teach us as a society and deserves to be respected as, it's not that, the vaccine, they're claiming the vaccine's causing cancer, which obviously is bad for everyone. It's causing autism, which people can learn and grow from. And I find that offensive when this is brought up.
Thank you for making that clarifying point. I also do not want to take anything away from, from parents who have children with issues relating to neurodiversity. They're some of the most, the parents who do that and raise their kids, they are some of the most amazing people in the world. Those kids are some of the most amazing people in the world too. There is, a tinge when I hear some of these, anti-vaccine activists talk about their children with autism. There is a tinge in the way they talk about their children that reminds me of the way that some parents talk about how they feel about their children if they turn out to be gay, which is another one of the reasons why I find it personally offensive. And in fact, of course, one of those two speakers did show up to make what I considered to be some transphobic comments at our March meeting. That's, again, of course, I think that the medical misinformation needs to be corrected, but I really and I know that this is causing our meeting to run long, but I really also don't want the autism community and, people who have any other issues with neurodiversity to get lost in that discussion that they matter too. And I really don't like the way that the anti-vaccine community talks about them.
Can I say something? Excuse me. Decorum aside, I think diversity of thought is healthy. I didn't hear that part, Doc, of the beginning of the comments, but we should encourage diversity of thought. And it feels like we're spiraling into some kind of, tit for tat on a comment forum. When, you pointed out Sarah, who sits here every meeting and points out needs related to health, we should be focused on helping Sarah. That's what we should do. We don't have a budget, so we could do message board things, or we could listen to the people who come to the meetings. That would be my comment.
So I appreciate that comment. I just have to say, among the comments that I'm responding to are somebody who said that there is a cure for a disease that there is not a cure for, but there is a vaccine to prevent. That to me is, I don't want somebody listening to that and thinking, I don't need to get my kid vaccinated for the measles because there's a cure for the measles.
I understand that, but you had a slide up that had 2019 vaccine dollar figures. 2019, what happened in 2020? The biggest vaccine event ever. So, I mean,
that
we
is
could
fair
go
enough.
tit for tat.
That is fair enough.
Move away from that.
That is fair enough. It is the most recent year that I was able to find data for all of
okay.
the categories that I was talking about. Does anybody else have any comment that they would like to make?
I'm not sure I do. I want to clarify my comment that I have no objection to diversity of thought. All in favor of it. I just think that the purpose of this board is the health of Radnor Township.
And maybe we should take the summer to think about the purpose. And if it's the student internship program, great. Let's focus on that. Or focus on the voices that come to talk to us and take the time to attend our meetings.
I'm sorry. I know that there's probably not much appetite for dragging this out. I have to draw a distinction between people who come to our meetings to, ask an honest question, make an honest comment, and people who come here to do performance art. And to me, when you show up, you're wearing a T-shirt for your organization, you're saying that you're going to hand out books for everybody when you don't have books to give. That is performance art. There are people who, think that they're going to become social media stars or whatever. I take all of your points, Drew, and, this is, my last meeting, so you don't have to convince me of how to run
Like,
the board.
have we cataloged all the comments by category to see what the most important thing is to Radnor Township residents? Or are we just like brushing them aside and then putting up stuff on screens? We could do that, or we can help people.
All right.
I actually think correcting misinformation is helping people. People in Radnor Township, people that are watching this, if you correct misinformation, it's helping people.
I agree, but let's have an arbiter of what correct information is. And that's a whole nother conversation.
But that's part of what we're appointed to do, in my personal
But
opinion.
are you a doctor?
No.
Okay, well, you just spent 20 minutes telling us about all this medical stuff. I'm not a doctor. And you say there's a source here, there's a source there. What are the sources? I mean, we can do this like a message board, or
I mean, I'm
we
sure
can
you
help
could
people.
provide the sources if asked of where you found the information.
Part of my whole point is that one of the comments that was the drumbeat from the anti-vaccine community has always been where is all this research? Where it is out there and it is very easy to find.
Fine, then they can go and find it. Let's do something real. Sarah, what do you have for us? Not to put you on the spot.
I don't think you're implying this, but I also just want to say I have also been very attentive to Sarah's public comments. I know you weren't saying that. I'm just.
It's just,
So we have had public comment throughout the time that I've been here, going on 8 years. And for the most part, we pay careful attention and we address issues that can be addressed. And we've had important issues raised. So I heartily endorse what you're saying. I'm not sure that, so I'm a doctor, but I'm not an infectious disease guy. I'm not a public health guy. I'm not a vaccinologist. I'm not a virologist. But I can damn well tell you that I can read the literature, and the literature on vaccines is peer reviewed. And we don't need to go over it anymore. And it is out there in the public, and this is not the forum to compare peer-reviewed literature against attacks on that peer-reviewed literature. That's in the literature, and it's outside of this space.
and that's fine. I mean, we sat here and had a panel discussion, I think 2 or 3 months ago, where we had 3 doctors from the same organization saying the same message: no diverse view. There was one diverse view, and everybody got upset about it. Now, could it have been said better? Maybe. I don't know. But the one person who dissented in the group, there was a half-hour conversation at the next meeting about how that was horrible. There's a big YouTube, right? Most viewed?
Yes. And I'm very happy that that presentation resonated
I'm
with
happy
the
too, but
community.
when you sit and look, three views, no dissenting view. If we want to do disinformation
It wasn't
and
a
have a
de-
healthy debate,
it wasn't
let's
a
have
de-
a healthy debate.
It wasn't a debate, it was a presentation.
Okay, no dissenting view, except for one. And then when it was presented,
Did I take the microphone away from her?
no, but the next meeting, you had a big,
Yeah, that's my free speech. I'm responding to what she said.
okay, and we can do that.
Yes.
We can go tit for
And
tat,
indeed,
or we can help Sarah.
I think you can do both. All right. Moving on. New business. The only thing I was just going to make a mention about the state changing the laws relating to cell phone usage while driving, that it has to all be hands-free. Does anybody have anything else they want to state under new business? All right. With that, we'll move on to public comment. Does any resident wish to make public comment at this time?
Part of me wants to run away. But anyhow, Sarah Pilling, 29 Garrett Avenue in Garrett Hill. I feel like the boy who cries wolf, except I'm a woman. And with the weather we've had the last 4 days, who's going to think about climate change and heat? Yeah, I have a real fix issue on this. And I beg, and you can't change it, only the board can change it, is Radnor should, and I don't like to use that word, be making contingency plans that may never have to be activated to take care of the elderly, the very young, and the immunocompromised from heat intolerance. Now, from the summer of 22, when we had 21 days of over 90 degrees, and I can tell you because I watched it, the night temperature never went below 85. It's the night temperature that's going to kill us, folks, because the body can't recover when it stays that hot. And I find it almost unconscionable that the township hasn't made a contingency plan, which, as I said, may never have to be instituted, inviting churches, schools, community centers, you name it, who would open their doors to people who can't pay the bill, the electric bill, don't have air conditioning and can't have it, and people who are immunocompromised so that they can recover, because it's not sea level rise that's going to get Radnor. We're really pretty inoculated against tornadoes. We don't have large pine forests, so I don't see master conflagration that burns Radnor up. But it's heat, guys, that's going to do it. And if you read the paper at all, God bless, it's not happening to us. But it's going to be 120 degrees in Phoenix, Arizona tomorrow. It's been 120 some in Pakistan, and they really don't have air conditioning. Now, this is not just talking off the top of my head. I don't believe in spouting stuff that I haven't experienced. So in 2022, because my crappy little house was built with a coal furnace and holes in the floor to get the heat up, it's not appropriate for air conditioning. So I went without it. And 3 weeks in, I was really sick. So I've experienced it firsthand. I have friends who live in Wayne that you would say, what a lovely big house. Guess what? It's not appropriate for air conditioning. It does not work. Maybe they're too old and they can't lift the air conditioning unit in and out anymore. I can't. I'm in a brace now. I really ask the Board of Health to, one more time, write the Board of Commissioners, and the commissioners pay attention to it. If we all work together, we can solve this potential issue. Thank you.
Thank you for your comment. Is there any other member of the public who wishes to make public comment at this time? All right. With that, I'm going to try to go through the recognition of the health-related dates and milestones as quickly as possible because we are definitely over time. It is Alzheimer's and Brain Disease Awareness Month. It is National PTSD Awareness Month. It is Cataract Awareness Month. It is Men's Health Week this week, June 10th through 16th. June 2nd was National Cancer Survivors Day. World Elder Abuse Day is June 15th. That's an event recognized by the United Nations, and Representative Borowski's office is also marking that day today. They are in regular contact with all 11 long-term living facilities in the district. Juneteenth is also World Sickle Cell Day. That's somewhat appropriate because there's a strong correlation with the African American community and sickle cell anemia. The only known cure requires a bone marrow transplant, so people should please consider becoming a donor. Donation is generally painless and safe. Most side effects are mild and similar to the milder side effects of vaccines, such as soreness around the site and muscle soreness. Most side effects are among people who commonly have side effects to general anesthesia, and over 97% of people who donate bone marrow are back to their usual routine after fewer than 4 days. So if you're looking for maybe a way to celebrate Juneteenth, maybe look into becoming a bone marrow donor. June 21st is International Day of Yoga. That's a recognized UN holiday, and in fact, last year, Indian Prime Minister Narendra Modi led the UN in a yoga session on the North Lawn at the UN. It's a great form of exercise for people who don't have a lot of time or a lot of space, and so maybe that's something to check out that day. The 27th is both National HIV Testing Day, and it is also National Sunglasses Day, and I did later, for any board members who brought sunglasses with them or anybody who's in the public, to take a group photo with our sunglasses on. As I mentioned earlier, it's also National Cataracts Month. If you want to put off that cataract surgery for as long as possible, or maybe even be able to do without it, understand that sunglasses are not just a fashion statement, they are a necessary safety feature. We can't put sunscreen on our eyeballs, but we can cover them with protective lenses. Optometrists recommend only buying lenses that specify 100% protection for UV light. Sunglasses should be worn outdoors even on cloudy days, and for that I recommend looking into photochromic lenses that will only partially darken on cloudy days. The reason why you need them on cloudy days as well is that even though it's not nearly as dark, studies have shown that over 75% of UV radiation still gets through on cloudy days. So you still need that UV protection even if you don't necessarily need the glare. And then, of course, as an additional bonus, by not squinting, you won't develop crow's feet nearly as quickly. So one more reason to wear sunglasses. Finally, this month is also Pride Month, and one more important thing to note this year is that the FDA has updated its guidance that had previously precluded gay men from donating blood and now focuses on behavior and time metrics. And also, I'll note that our presentation from National LGBTQ Health Awareness Week now has over 8,000 views on YouTube. And so I'm very happy to see that that presentation resonated with the community. I had set aside some time for outgoing comments for the board chair. We are well over time, so I'm going to elect to defer that and instead just move along to elections for officers. So just so everyone understands the way that this works. So I am stepping down as chairman. I am not vacating my seat on the board as of yet. I anticipate vacating my seat over the summer. The reason for keeping the seat for now is that we have, as I indicated earlier tonight, a couple of presentations in the works that I may want to finish up doing some planning on, before resigning my seat all the way. But I'm not going to be around come September, so I will not be around to be board chair. So the way that this works is when I officially resign, Drew, as vice chair, you become the acting chair. You are then going to have the responsibility of conducting an election for the chair position. If you are not elected as the chair, then whoever wins that election becomes the new chair. You remain as vice chair. We don't have another election for vice chair. You just stay on as vice chair. If, on the other hand, you are elected as chair, you then have the responsibility of conducting an election for the new vice chair to backfill you. So with that, I am officially resigning, and Drew, you can come over and take your seat as acting chair. And I'll just say, since I'm deferring my longer comment, that it has been an honor and a privilege to serve in this position.
In my first acting position, close us out. Close us out. Do it.
Thank you, Al.
All right, what do I do, Doc? Thank you. Motion to close the meeting?
Motion.
You need to conduct the election for the new chair.
Oh, I thought the election was in August? No?
No.
Okay.
And to further complicate matters, I have to go to my daughter's senior awards
Go.
night, which starts in 13 minutes. So.
Do I have a play sheet for this? Because
So you ask for if there are any nominations first.
any nominations for chair of the Radnor Township Board of Health?
I'll nominate Drew.
Second?
Second.
Any objections?
No, you have to, all in favor.
All in favor?
Aye.
So
All
moved.
opposed.
All opposed?
Right. So,
Motion to adjourn?
nope, now you have to conduct the election for the new vice chair, because that's
Oh,
vacant.
I thought you were saying that was in August.
Well, I don't know, Maggie, can we, actually, since we don't have to take minutes anymore, can he just
Because
defer that
there's-
election until August?
We don't
Yes.
have,
Leave it vacant? Oh,
don't have
okay.
everybody
All right,
here.
sorry.
Yeah,
Yep.
since you
Then-
don't have everybody, and Lisa just left, who
Yep.
might have been one of your
So then you
candidates.
can motion to, so then you can take a motion to adjourn.
motion to adjourn?
I'll motion to adjourn.
Second.
Second?
All right,
Meeting adjourned.
all right. And then a 5-minute break before we go into the presentation. We have a presentation tonight. It's from SNAP.
Yeah, I can't stay for that.
Okay. All right.
I was here for the other three.
All right, so Ian, just keep the feed running and we'll start the presentation, I guess, in a couple minutes. Congratulations.
See you next week. Almost certainly things will change direction, just like you changed significantly from direction you went. I'm not sure what that microphone goes. Nobody else was nominating anybody? I don't disagree with the notion that diverse opinions should be heard. People are entitled to bring their opinions to the table. We're really not a forum for opinion. We're a forum for
I don't even mind that, but he has like an objection with the Board of Health correcting medical misinformation. Like, duh.
well, so
Well, that was part of my problem, is like, it seems like you're saying that I'm doing something wrong, but you're not saying what it is, other than maybe you don't have the length of time. That's the thing. He wasn't here, so he doesn't even know what I'm responding to, but he has an opinion about it.
It's pretty offensive.
I'm sure
It was pretty offensive. And again, if somebody has position taken by the board, we can really take many positions until we're asked to take a position.
I mean, I've expressed my personal opinion that vaccines work, and that, you know, if he has a problem with that, that's, you know, he's allowed to say that, but, you know, it's like, I mean, it was sort of like he's saying, like, who the hell are you to say this? Like, you know what? Our democratically elected people put me on this board, and then I was democratically elected to sit there. That's who I am. And now you're the person who sits there. That's,
So
you
there's,
know.
but there, again, the public presenters took advantage of an opportunity to have a microphone, put information, which is misinformation. And the medical literature is right now rife with, including the CDC website, how do you combat vaccine disinformation? Give vaccine information. So I don't know. It felt to me like he might have been a little bit on you about the earlier one. And I wasn't
Right, and
there.
so he wanted me to have, what, somebody who, what, an anti-gay activist on the panel with, you know, medical professionals. It wasn't a debate, it was a presentation with a question and answer.
It was about health, not about.
And I don't think I spent a half hour responding to it.
That was a good start.
Anyway.
Alrighty. I gotta go.
Thank you for everything you've done.
Yeah, thank you. I hope my presenter didn't just decide to leave.
Would it, yeah.
I mean, he's gonna be presenting to me in the camera if he still presents, but that's fine.
Where are you going?
I'm going back to school,
For what? Where?
going to
for
get
what?
an MBA at NYU.
We'll stay in touch, Alex.
Yeah.
Please do.
Yeah, but Chloe's very interested in joining the board.
That's so exciting. She said something to me about, oh, what is it, fundraising? And I didn't know.
Yeah.
I don't know what the, she's the other board, but I don't know what the.
You know what, she is, but you know what, if she, because she's a student of Oklahoma, she can get a lot of photos with Oklahoma, and she'll also have access to all of those professors and potential presenters, so, yeah. Yeah, no, yeah, I mean, she's, you know, she's young, but I think she'll work her butt off.
Oh, yeah, she will. So here's what I would think would be best. I won't that. Go ahead and bring her on as the information intern.
Yeah.
And dangle the carrot.
Yeah, that's what, that's exactly what
I think that's good enough. You guys have done a great job with that program. And that program is a
yeah, she, yeah.
You know, my first time doing it, she did not need much. We had some calls at the beginning, but she had an idea and it took some time. She, and,
Yeah. So it's about like child abuse and, you know, what can be Just for anybody still watching, I just want to announce, so we discussed with our presenter and we are going to be rescheduling. Thank you.